So, Dr. Scrase, of course, we have been chatting with you over the last year and about 3 months, almost a year and 4 months now, ever since the pandemic first took effect. The state took some very aggressive moves to try and limit the effect and the spread of this virus. We are now at this point where we'd be kind of on pins and needles all week waiting for this decision after hitting that, setting that goal of 60% vaccinated for 16 and over. We are at a point today where we're not quite at that number, but the state chose to make this decision. And I guess I wanted to just maybe start with that. Why did the state choose to make this decision here to reopen on that July 1st date, with being just almost at the goal, but not quite at the number, the 6-0 number that it had set?
Well, when you're dealing with 2.1 million people, Chris, every number has a margin of error. No number is exact. And in this case, we have a lot of data still streaming in. It's kind of like calling an election with 95% of the votes in a district. We have enough data now to know that there's a lot of New Mexicans who helped us by calling, and we matched, for example, Dave Scrase with David Scrase. Very similar names, obviously the same person, but two different vaccines. All of a sudden you combine a completed vaccine. Huge push. The incentives worked very well this week to get people out to get that single dose vaccine or get their booster dose, which is so important. So that's been fantastic. We have data coming in from Texas now. We've made those connections and we're scrubbing that data. And last night, people were up late, long lines, getting that vaccine. So while we haven't counted all the data, we're very, very confident that we are within that margin of error to declare that we've made it, that the state's going to reopen on July 1st after 465 days of pandemic here as of today. So we're super excited.
And I wanted to ask you about that excitement level. What is it to finally make that decision for you guys? Because, I mean, we certainly have heard for so long, the restrictions that have kind of limited our activity. And we've all lived with this now for so long. What is it to finally be there to make this decision? What was maybe the mood of the room when you guys were all meeting there today talking about this? Maybe it was a Zoom room you were all meeting in.
Yeah, I think that it's sinking in. This has been an incredibly long haul. I know that I've worked harder than I did during my medical internship, which I was pretty sure was the hardest I'd ever have to work in my life, but it's no different for all of my colleagues either. And everyone's just worked incredibly hard. And I think we're just getting ready to exhale and to start that celebration. But, we're still counting and still telling and still answering the phone and still arranging, frankly, vaccination appointments for next week for people, because this isn't over. We've just met the target we believe we needed to be at to open the state. I think the other thing about the exact number is, remember, and we knew this at the beginning, we've got folks who had COVID, who have immunity, that didn't get vaccinated. We know that that's about 50% of the folks who got COVID have been vaccinated, 50% have not. So that other 50%, they have some immunity. We also know that there's a lot of people out there who maybe had a mild illness or didn't even know they were that sick, who probably had COVID and had some immunity. So, we were going for a number that we thought would be safer to open everything to the public, and that's where we're at. I do want to mention, we're not stopping masking guidelines, social distancing. Those things are still in effect. We're now following the CDC recommendations, which you can see on their website. So it doesn't mean everything is back to normal. Frankly, we still have 40% of our population that's not vaccinated, and we've got a new variant coming in to our state, our country, and our world that is much more aggressive.
I did want to ask you about what does this mean now, just to really make it clear for folks out there who are going to hear about the reopening now. What does it mean to reopen fully on July 1st? What are the key things that are part of this?
I think the key things, if you've been to a restaurant like I have in the past month or two, there are still restrictions, even at Turquoise, 75% capacity, mass gathering limits. They're pretty big, 150, but nonetheless, those will be gone as well. every business can be as open if they want to be to as many customers as they want to have. And so that's the biggest thing. We can start resuming our normal routines if we want to, grocery shopping or those sorts of things without much concern. I do think that, a lot of things have already opened, but, big sporting events, we believe should be pretty safe for people within the constraints of whatever the CDC continues to instruct us on about distancing and spacing and things like that. But I think for the most part, the business aspects of this, tourism, all those other things are now open, and we can all get out and enjoy the New Mexico summer. We can have visitors from other states fully enjoy our beautiful, beautiful state, the beautiful people in this state, the wonderful food in this state, and all the great things there are to do.
I know one of the more recent news conferences, one of the questions that got asked was, will there still be some kind of a health order in effect once the reopening occurs? And as I understood, there were some parts of that in all likelihood, yes, because a lot of it had to do with sort of the federal funds that come along with being in a part of a health order. But is there any idea at this point of what kind of order does that look like, or what are going to be some of maybe the components that will exist in a continued health order, though, say on July 1st?
Yes, so we're working on that now. I had a team meeting today to talk about that. There are lots of components of how are we going to manage this pandemic, which is not over, going forward in a longer period of time. How are we going to respond to outbreaks? How are we going to respond if there's a new variant that's hopefully not resistant to the vaccine, or what if there is? And so we're putting those plans together. I think all of the economic restrictions should be gone July 1, and connections to the guidance of the CDC will still be in place. Other really more obscure public health orders and guidance regarding labs being required to report all the COVID tests, that's not going to really change at all, but most of us don't have to deal with that on a day-to-day basis. So I would say for the average New Mexican, it'll be a combination of a free and open economy and whatever the CDC is telling us about things we ought to consider in terms of masking, particularly if unvaccinated, schools, workplaces, all those things that we think will be coming out soon.
I see. One other question I had was related to kind of the idea that I think nobody probably wants to really think about, but the chances of going back. Do you think that there is a slim chance of going back at this point now, with where we're at in the virus? I mean, obviously, variants to viruses can do a whole lot of unknowns that are sort of out there, and this is a very speculative question, but I did want to at least put it forward. Is what is the chance of going back to any type of restrictions that we've sort of dealt with?
Yeah, let me use influenza as a parallel. I'm going to go way back here, Chris, if that's okay with you. But back in 1920, when the influenza pandemic ended, people thought, boy, we're sure glad that's over. And I know that we're all getting annual influenza vaccines, even to this day, that make adjustments and little tweaks, on what the virus is going to look like in the coming year based on what it was in Australia in their winter. And so that, I think, we don't know how that's going to play out yet. But when we talk about going back to, when I think of going back, I think of going back to November, December, when hospitals were overflowing and we ran out of ICU beds one night in the whole state. That I would compare to 2009. Remember when we had the H1N1? That was a major variant, likely to be resistant, likely to cause a lot more illness, hospitalizations, and deaths. And so we had a worldwide campaign to revaccinate the world against that major variant. So I don't know. I think we are going to be keeping our eye on the science and the data for both of those, that what is coronavirus going to evolve into? Is it going to be a winter respiratory infection eventually, like influenza? Is it going to be that plus these very hopefully rare resurgences of a more serious version. It's all in the future. I can't predict, but I think we have to be prepared and be thinking about both.
Yeah. I wanted to jump back to vaccinations as well. We talked a little bit earlier in our conversation here about hitting that 60% goal. It sounds like you feel very confident with sort of the data that's still to come in, that we're really close to that, if maybe not over that right now with some of the outstanding data. There is still a push to get vaccinations happening. And along those lines, I mean, and you had mentioned, I think, as well, the idea of those who have had the virus but maybe have not been vaccinated. So when I think about the sort of infection related antibodies versus or combined with the vaccine related antibodies, is it maybe fair to say that New Mexico is close to the idea of herd immunity? And how much more does the vaccination campaign sort of keep pushing on aggressively?
Well, true herd immunity, Chris, really creates the obliteration of the virus. So I think our thinking about coronavirus has changed, and the idea is it's more it's more likely to be like influenza, where we'll never achieve true herd immunity, but we can dramatically reduce the chances that it'll spread from one person to another. So we're not talking about that as much anymore as getting enough people vaccinated to get that case count low and keep it low. There'll be cases, I've said a couple times, we have two pandemics. The one we're announcing today that's over really is the pandemic amongst the vaccinated, the pandemic amongst the unvaccinated, particularly the pandemic amongst the unvaccinated, particularly in these rural counties, in where there's very low vaccination rates, is likely to have some very tense moments, particularly as we get into the fall and winter. And so we're just going to be balancing that. Two important points about vaccine. I have family members who've had COVID and were vaccinated. The COVID that you had might give you one set of antibodies. The vaccines that are available seem to give you a more robust set of antibodies. So that's a reason to get it. We've also just learned that one of the major vaccines, Pfizer, in the Delta variant in Asia, right now, if you have one shot, it's only 33% effective, two shots, 89% effective. So that was the second thing of this whole 465 days that scared me, is when I saw that and the fact that spread of that variant, the curve goes straight up in about a 2-week period. And so if you're sitting at home, you've only had one shot, get that second shot, because we fully anticipate that, like the Alpha variant took over New Mexico and went from 0% to the 70% we're at today in about 2 months. We think we're going to see that with Delta. And that's one where we absolutely need that 2-shot series to be fully protected.
Do you anticipate that any of these sort of incentive campaigns that we've seen, whether it's the Vax to the Max sweepstakes, I know is taking part, and I imagine that's probably more of a one-time kind of thing that's going to happen, but the $100 campaign that started this week, would you anticipate any other incentives maybe that the state is looking to bring back to continue to sort of push vaccines out there? Because from what I gather from you, the importance of still trying to get as many people vaccinated is still very much there.
Yeah, there's absolutely no question the incentives work. And they actually worked way better than I thought they would. We had an incredible surge, particularly over the past couple of days, of people coming in. And, everyone's life is different. Everyone's in a different situation. Part of what Laura Parahone and Tracy Collins, the two doctors at DOH that are running this vaccine effort, are doing is drilling down into the smaller population subunits that haven't been vaccinated quite as much. We're working with the University of New Mexico to understand what motivates each of those groups of people. And so I don't know what we will do, but I certainly know that we're going to do whatever we feel like we can do to put people in a situation where they feel like it's in their best interest to get vaccinated, where we help them overcome their fears about vaccine, where we encourage them or even connect them to their healthcare decision makers or their primary care providers to have that discussion. And so we're still going to be on that for quite some time.
Does New Mexico, once we've hit that 60% mark, I should say, we've aimed for that 60% mark over these last several months of 16 and up. Is there a new mark yet that may be existent out there for when we start to factor in now that it's not so much about hitting that mark as much as it is now, just like kind of moving out into the rest of the population there, right, to include, say, the 12 through 15-year-olds and then maybe perhaps the even younger populations. But maybe I should just ask, simply put, is there a new vaccination mark you guys are aiming for yet?
Well, I've worked with the governor for a really long time, and I would be shocked if she doesn't have a number in her head. I know she told me yesterday she's been reading the new science about the Delta variant and wanted me to send her some articles, which is one of the things I love about working for her. But I think part of our task for the rest of the pandemic is to come up with new targets and goals to achieve. Every business, every organization, every governmental agency does better when we have a target. And so we'll be talking about that. That'll be part of our pandemic plan. Frankly, the more people we can get vaccinated, the better. I suspect that as the Delta variant comes through New Mexico, that there will be some, I suspect that as the Delta variant comes to New Mexico, there'll be new things that are going to be happening that will motivate people to want to be vaccinated.
Right on. Well, maybe just one of my last questions for you is kind of just going back to the announcement today. Really, it's it's believing that the state is within that margin of error of at now being at about 59.4% of those 16 and up have hit that full vaccination mark. The state feels it's within a comfortable margin of error to reopen. What would you tell people out there today with the announcement of this news? Maybe what is just the thing that perhaps I didn't ask you that you want to get across?
Yeah, I would actually speak on behalf of the governor and thank every single New Mexican who worked with us for the last 465 days to get to this day. New Mexico started, this wasn't a race where we were all starting at the starting line. New Mexico was one of the last people in the race. Very high social vulnerability index, lots of low income individuals, lots of infrastructural issues like internet that we still lack in large parts of the state. And for us to come from the very back of the pack and end up where we are is just miraculous. And it really is due in large part to the effort every single New Mexican made to stay safe, to get vaccinated, to watch out for your family, to watch out for yourself. And so this is really your victory. We're just announcing it. We're there, but we're there thanks to you. And I'd like to deputize all of your viewers, Chris, who have been vaccinated and believe in the vaccine as strongly as I do, that it's the only thing that will make this pandemic go away, to encourage your friends, neighbors, close colleagues to reconsider it if they haven't gotten the vaccine already. And that's it. We're delighted to be here. And thank you also to the media for incredible support and reporting those numbers and news. I'm pretty sure in July, you won't have a daily COVID report anymore. You're going to have more of a baseline way of doing it. But you've been great partners with us as well, and we really appreciate it.
Well, thank you. And yeah, we appreciate you being there to answer all of our questions, as speculative as some of them are, and then as more minute as in detail as some of them get. So we appreciate all that info you've been able to give us in that time.